Good afternoon, everyone, and good morning to those of you on the West Coast. Welcome to part 2 of our 3-part webinar series, Finding the Power in Numbers. My name is Bernard Hernandez, and I am Chief Information Officer with DM&A here in San Diego. We appreciate you for taking time to join us today. Just a few webinar logistics before we begin. During the webinar, the phones will be on mute and you will be in listen-only mode. There will be a short question and answer session at the end of the presentation. In order to ask a question, please type it in using the questions box in your GoToWebinar control panel. You can type a question anytime during the webinar, and we will answer as many as we can. And those that we don't get to, we will reply via email after the webinar. I am very excited to introduce our 2 amazing presenters today. From Portland, Maine, we have Mary Keysor. Mary is a success coach with DM&A. Previously, she was the food service director at Maine Medical Center. She has won the prestigious Silver Plate Award and was past president of HFM, which is the Legacy Association of AHF. In Mary's free time, she enjoys spending time with her family, and she is an amazing artist. And from Elmhurst, Illinois, just outside of Chicago, is Dave Reeves. Dave is the Director of Hospitality Services at Elmhurst Memorial Hospital, a 430-bed hospital where he oversees both food and EVS, among other areas. Dave also serves on AHF as Treasurer-Elect. So without further ado, please welcome Mary and Dave.
Thank you, Bernard. You always do such a nice job with your introductions, and I too welcome you to this webinar. As Bernard said, this is part 2 of a 3-part series, Finding the Power in Numbers. In part 1, Bill Klein and I discussed first things first, getting comfortable. We talked about common mistakes in numbers and sort of setting the stage for parts 2 and 3. Today, Dave Reeves and I will be up to talk about the power in numbers. Dave and I are both dedicated to using numbers in management, and we've worked together for a number of years on this. And we will focus today on tools and how to make this process easy. But first, let's start with the curriculum. Today we're going to talk about a few issues. One is going to be getting started and making it easy. Finding data, Dave's going to be very helpful in helping you find the data. Process for counting meals and meal equivalents. Meaning of foregone revenue. Actually, we're going to spend quite a few minutes on that particular topic because it is so important. And we're going to review 5 industry tools. So that's the blueprint for today. And Dave and I will get started. But Dave, I'm going to have you start us getting off.
Great. And thank you, Mary, and thank you, Bernard, and everybody. I'm glad to be here today to talk to you about a subject that I feel really passionate about. And it's something that, throughout my career, we had the opportunity to do many of the tools that we'll be talking about today. And I think, for those of you that just may be getting started out there, I think the important thing to realize is the step 1 that you want to realize is that you really want to select a methodology and commit to doing it. This needs to be something that is part of your daily or weekly or monthly routine that you're doing while at work, and it's not just something that when the budget cuts come up or right when you're preparing for budgets that you scramble to try and pull this information together. So really, if there's one thing that I want to impress today, it's really selecting one of the tools, whichever one it may be, and then committing to it. I think the thing that I've really found to be successful for my operations is I was able to find somebody in the department who really was almost as passionate about this as I was, and she's very, very detail-oriented. And so I've been able to really also rely on this person as a designee, and she's been really very supportive of it. So, this is something that I would say that you just can't do alone, nor should you try to do alone. So you want to really try to find people out there in the department that can help you with this, and especially if there's somebody out there that really knows numbers or wants to learn more about that. Today we'll talk a little bit more about what type of data to collect, and I think it's really important for you to understand what data that you do need to collect, because without collecting the right data and pulling it together properly, you can either overstate or you can actually more commonly understate the number of meals that you do. So that's a very, very key thing. And as well as, this is really can be very simple to do on an ongoing basis if you do set up the systems, and to do it regularly and to do it very similarly every time, so that this is something that if you set up the systems, you'll be able to really pretty easily get it going and do. But if you don't set up a system, it's going to be something that where every single time you're, how did I do this? What do I need to do? So set up a system as well. And I think it's also very, very important to communicate the importance of this to your management staff, as well as the frontline staff working in the department. We do a lot of meals in the department, and those meals, every single one of those meals needs to be counted. And if people understand why they're counting the meals and what importance that plays into the cost per meal, what the importance that plays into productivity, they're much more likely to begin collecting that information and helping you with it, rather than say, oh, this is something that we do, I'm not sure why we do it, but the director's asking for this. So I think it's really important to encourage your staff to help, as well as including this in your staff merit review. This is something that you want to include in the financial section of your merit review, or maybe in goal setting, but something that make it part of everybody's job to assist with this. So I think when we talk about benchmarking, or we talk about collecting, getting your numbers, and I think there's a lot of positives that can really come out of this. And I think the first thing is that I would like to stress is that it's really important from your director's role that you need to ensure that the department is fiscally sound, operating in a fiscally responsible manner. You have that not only to your organization, but you also have that to your staff. One thing that I learned early on in my career, when I had to make some drastic cuts, and it impacted people's jobs. If we are not being financially responsible, we can end up having people sacrificed at a time later on when the budget cuts do come. And I would also remember, in most organizations today, budgeting is done based upon productivity. So I'll talk a little bit later about how things are done in my organization, but I would bet everybody out there, productivity standards are really potentially ruling the budgeting decisions going on in your facility. As well as, if you are somebody that is knowing your numbers, able to communicate your numbers, you're able to enhance your credibility. And I think lastly that I'd like to mention is that, especially if you're new, your knowledge of your food service process grows. And so it's really, it's beneficial in those aspects. And Mary, I know you have some thoughts about the positives as well.
I do, Dave. Administrator credibility is not to be underestimated, and I think we all know that. It certainly never hurts to have solid numbers at the budget table. But recognizing that, I'll tell you some mistakes I made. As we go on, let's remember that in healthcare, turnover among senior leaders is not uncommon, and new leaders bring in new questions. My first contract threat was not pleasant. I didn't have a clue about numbers. The president I had at the time was supportive, and I had a great boss And I was busy. I really didn't think I had time for numbers or needed them. But the president left, and a new leader had more questions. I survived because of my boss. I was lucky. My second contract threat, a few years later, again with a new president, was easier because I had the numbers. And my third contract threat with a new senior leader didn't occur. And I have to think it was because administration trusted my financial knowledge.
So
tell a little bit about where to get this data. Everybody I work with says, I don't know how to get this data.
Well, every organization is different. You know, you're going to really have to find out within your organization where you get the data. But I think there's generally some common areas that you'll want to look. And I think the first place is, you know, finance, of course. And I was very successful by finding a couple key people in finance that were really helpful to me. And you know, so when I pull information or I ask for information, you know, they're able to give me the information and also being able to coach me on this. So, but the first place that you're really going to want to look are, you know, especially your monthly expense reports. So, you know, you're going to want to look at what is your, you know, your cost of supplies, breaking it out by food costs, by labor costs, you know, productive and non-productive hours and dollars. Finance might be able to help you get patient days or adjusted patient days or adjusted discharges if what your tool that you're looking at calls for that information. I think the other place that you really want to look at is in your departmental records. And again, hopefully you've got this set up, but if you don't have this set up, you really need to look at, you know, your retail cash. You know, you're going to go to your POS system or your cash register, whatever you might have, but you're going to need to be able to pull out that retail cash and also tracking floor stocks, making sure that you know the cost of those floor stocks that are going out of the department, knowing, you know, any other cash that might be coming out or going out or meal equivalents. One thing not to forget is rebates. You know, if you're participating in your GPO and you're getting rebates, and you know, that's a result of your food service purchasing philosophy. So, you know, even if that goes to a different cost center, for example, in my organization, the GPO rebates for food go to the materials management department in a Premier or Novation rebate bucket. But I find out what the amount of that rebate is so I can credit it back to my department, because we're the ones that are directly responsible for getting that for the organization. You want to be able to identify any transfers or credits and foregone revenue as well. And I know we're going to talk a little bit more about foregone revenue because it is one of those things that is very important to be able to collect and make sure that you're able to you know, identify those costs as well, because they are costs due to the organizational decision philosophy on what they've decided to spend the money on. So, Mary, I know that you know, you're also pretty you have a word on consistency, and you're very passionate about that as well.
I really am. Consistency is always a challenge when tracking data. Tools we cover today will define how to count meals and meal equivalents. They all do. But, you know, it's human nature to want to do it the way it's always been done. That's where consistency comes in. We all like to do it our way, and I get that. But number tracking, that's not an option with this process. We've got to encourage you to follow the tool and hope that when people enter their data, that it is consistent with what the tool is requesting. Consistency also applies to how often the data is entered, and we'll talk about that later too. one of the things people ask me about, and I can't say this is necessarily frequent, but it points to consistency. If somebody is currently using upcharges for floor stock and internal catering, and the tool they decide to use says don't use upcharges, then obviously that's the rule of the tool, and it doesn't want you to include those upcharges. It sometimes takes a while when I get that question to work with the food service director to come to an agreement on that. But again, consistency is what we enter and how often we enter to. We said that we would spend some time on foregone revenue, and you'll hear that word frequently in this webinar because it's an important topic and it prevents a missed opportunity for so many managers. By definition, it's a service you provide for which you don't get credit or a transfer as a result of an organizational decision. When you don't know the cost of these services, which are referred to as free, your department's productivity suffers. Now, I mean, we know nothing's free. And I guess that when I work with people on collecting data, it's always difficult to get someone to stop and say, well, let's see, how can I figure out what the cost is of this particular service? But it's going to be so important for you to do that because of the productivity connection it has. And Dave's going to, he's going to explain that a little bit better in a little while. You know, I think what we as managers do is we're managing someone else's money. And we have a fiduciary responsibility to know where that money is going, know what it costs, share that information with administration. Dave, can you shed some light on revenue and what kinds of impacts it has on productivity? And maybe give us some examples?
Yeah, absolutely. So, you know, we're constantly providing these services that we may not get credit for, that Mary was just talking about. But if we don't track those, it does not come to a meal equivalent. So it's almost like we never perform those things, even though we are actually doing the work. The labor is there to perform them, and so it's really important to track those, because I think it's also important for you, especially around budget time, to have those conversations with your leadership about these type of things. You know, we've had in my organization, I've had quite a few examples that I share here that are things that we have an organizational decision. So in my organization, any type of physician, staff, meals, dinners, things like that, those are things that I do not charge for. It's just a freebie out of my department, but I track that so I know what's going into the doctor's lounges, what's going into any type of meetings that the doctors are having. You know, and I have that conversation, say, do we want to cut back on this? You know, the answer is almost invariably no, but at least the subject has been raised with my VP. Another one is board functions. You know, are we going to stop feeding the board? Probably not. But the conversation is there. You know, subsidies or discounts. You know, this is one that I had a facility that was it was a cafe that was in about a 200 staff. It was a facility that was staffed by 200 people. It was subsidized to the level of about $70,000 per year, and every year I would bring it up and I'd say, is this something we want to cut? No, no, no. Well, finally, they ended up deciding, you know what, it's worth making that change. But it would have never happened had I not been able to bring that up and start many years earlier. If you do any type of free meals, whether it's free beverages for the staff, or it's volunteer free meals, or anything like that, those are things that you're going to want to track and make sure you know the cost of those, because you at least are able to have that conversation, whereas most oftentimes the conversation could revolve around how many FTEs can you cut out of your department, and you want to at least raise this subject. And not that it's going to change necessarily immediately, but it's something that's you've had the conversation. So I think the next slide we want to talk about are some of the tools that are in the industry. And this is what Mary and I really are going to focus on for the remainder of the session today. And we look at the 5 common tools. And many of these here you're probably already familiar with. Some you may not be. So the first one that we have is KNDS, and Knowing Numbers Drive Success. That's a DM&A proprietary program. Then there is Benchmarking Express from AHF, Baseline with U.S. Food Service, Action OI from Truven Health Analytics, and Operations Advisor from Premier. So, Mary, did you want to start taking us through KNDS?
I do. And as Dave said, this is an overview of these tools. There are others in the industry. We picked 5 we thought were would give us a good kind of examples for you to choose from, so you can pick your own that's best for your own facility. But KNDS is DM&A's electronic tool, and it's an interesting tool. It provides users an easy way to organize and centralize data, simplifying the tracking process, which can be cumbersome in the beginning. Early on, DM&A recognized that our clients could benefit from a tool that would bring data from all department areas to a central location. And this easy-to-use Excel program does that, giving real-time, at-a-glance data. I think the beauty of this tool, other than it being so easy to use, is that it uses the average retail transaction, or ART, to auto-calculate meal equivalents to the master data page. Using the ART makes it compatible and a good first step to AHF Express. Once the data is in KNDS, it can easily be transferred. I usually say it can easily be dumped, but transferred, probably a better word, into AHF Express on a monthly basis. Our clients have personalized coaching to help them get started, and one-to-one continued education to help them understand what the numbers mean. That's the part of my job I like best. This tool requires the user to learn what the numbers mean and how to find power in those numbers. Once our clients are comfortable with the data process and they know what the numbers mean, we encourage them to join AHF and enter Express so they can compare themselves to their peers. They continue to use this tool because the data points are the same as those required by Express. KNDS standardizes the methods for counting meals with the average retail transaction, and when used proactively, gives potential to make real-time decisions rather than waiting for accounting reports. It tracks internal data showing trends for budgeting in a quick one-access point for your key financial information. It's right on your desk on your computer. Bernard introduced us this morning, Chief Information Officer, and I got to tell you, one of the most patient people I have worked with. He and I developed this tool, but Dave was the beta site, and he gets credit for making the tool user-friendly. Dave, what was your experience using KNDS?
You know, it was really, I think, a great tool for us to be able to participate in. Again, I was able to utilize the resource in my department to really go through this and look at this from a perspective of not what fits Elmhurst Hospital the best, but looking at what would fit the majority of hospitals and how do we develop something of that nature. So, Mary had the methodology. We helped her with the function of the tool, and Bernard really helped with making it a very user-friendly tool. So I was very happy to be part of that. So thanks, Mary.
And I have to say, with Dave's help and Bernard's patience, we went from version 1 to version 17. Actually, now I think we're at version 21 or so, and it's all become because of Dave's help and input from clients. Key metrics. We want our users to know what net cost per patient day and net of cash mean and the difference, along with other metrics. Then they can talk with finance in their own terms. ANDS auto-calculates some of these metrics, and the data for the other two is also available. So when the information and data is input into the KNDS system, it will automatically auto-calculate food cost per meal, net cost per patient day, net of cash, dietitian hours, worked hours per meal, and made it very easy to figure out total cost per patient day and floor stocks. I think you're going to find that all the tools we talk about today will do the same thing. They'll all create key metrics to help their users focus in on what they think is important. And that's so valuable to a new user. And Dave, I'm going to turn this over to you now for the next tool, AHF Express.
Thank you, Mary. And I'm here to talk a little bit about AHF Express, and on behalf of AHF, I'd like to say that this is probably one of the largest member benefits that we have, which is the AHF Express tool. And it's something that if you are not utilizing it right now, I would really strongly suggest that you use it. Put in your data, as well as making sure anybody who would like to learn more about it, feel free to reach out to AHF. But the tool in and of itself is excellent. It's all self-reported. So this is something that, unlike some of the other tools that we'll potentially talk about later, that we'll be talking about later on, where it could be organizationally driven, AHF Express is really something that the food service director should be driving. And the beauty of this is that the results that you get out of this, you can sort it by your bed size, by region, by service type, by hospital type. It uses the average retail transaction to calculate meal equivalents, and it's there's financial and customer service data, and it's all submitted online. The data submittal is monthly, and you receive the information back really very rapidly after you're submitting it. And not to mention that the database is confidential, so it's something that isn't going to be shared with anybody else. I think the one thing about AHF is that the AHF Express is that, especially for new people, this really it requires you a little bit to learn about the different results and how you interpret those. So it can be really good to help you with your growth in developing as a leader. The output, you really get you get the trends, you get a lot of graphs. There is a enhanced version if you wanted to get that, as well as the listserv. The listserv is out there, and I think that's another AHF member benefit, that you can reach out and talk to people, and it will also put you into percentile rankings. And again, it's viewable for the food service director to look for the areas of opportunity. So again, this is something that you look at. You can determine, okay, I'm seeing a trend here, so maybe I should start working on this now, because if I don't, I'm probably going to get the same results later on from one of the different tools that finance is having us do. So again, you can prepare that ahead of time and be a little more proactive. as well as there is a mentor program available. So you do have the ability to reach out to other AHF operator members who have reached out or that are willing to reach out to people who aren't quite as comfortable with benchmarking, and to help guide you through the program as well as help you interpret some of the data. Some of the key performance indicators that you'll get out of AHF would be, the average retail transaction, the dietitian hours per meal, net cost per patient day, net of cash per patient day, total meals and total patient meals, and for stock costs. So again, a great program. This is something that you, as the food service director, really need to drive, and it's something that's part of AHF membership, something that you should definitely be taking advantage of. Mary, I think you'd like to talk about the next tool, the U.S. Food Service Baseline.
I do. Thanks, Dave. U.S. Food Service offers a value-added service to their customers to help them define opportunities for improvement. It can be used to establish goals and review financials. The results are plotted against percentile ratings, and if a user wants to talk with peers in other facilities, U.S. Food Service will arrange that too. This is an interesting tool in that it looks at the past 12 months financials, providing a comprehensive review of department activities for that period of time. The process is that the food service director submits department financials for the past year to the U.S. Food Service rep, who will forward that information to the baseline staff for assessment. Baseline uses the market basket to calculate meal equivalents. It tracks data from multiple department areas and presents it in an executive report. Very impressive executive report, by the way. This report is a review of the past year's financials presented in a format certainly appropriate for sharing with your administrator. It offers operators a chance to compare baseline results to other benchmarking systems, and that's an interesting process, to look at results from baseline and then compare those results to another system. It's a really interesting tool, an amazing review of department functions for the past year. And some say it saves time because it's done once a year. Dave, I know you too have used Baseline. Do you want to add some thoughts?
Yeah, I've used Baseline in the past, and it's been a very effective tool for me to use in the past. As Mary said, it's something that really is looking at the last 12 months or whatever time period you want to give them. So a little bit different in that respect. I think the other thing too you need to think about with Baseline is that you're really opening up all your financials to a vendor. I know some organizations have no problem with that, and some do. So that's something you may want to check with your organization. But overall, I've used it and received excellent results. And as Mary said, a very impressive looking report. One of the better reports that I've seen come out from an impressive looking perspective.
It certainly is. Action OI from TrueVen Health Analytics is our next tool. I'm going to give some background on that, and then I'm going to ask Dave to weigh in on the next slide for Action OI. But this is interesting, actually. It's a very comprehensive benchmarking tool conducted usually quarterly, helping complex organizations find efficiencies. And it could be quarterly, but it can also be customized for organizations. Now, unlike the first three tools we just talked about, which are department-specific, Action OI, of course, is global for the whole system, but will give information for food service as well. This tool has a history. In the 90s, MECON was a popular hospital benchmarking tool, and it used market basket to determine meal equivalents. My hospital used MECON. I benchmarked with AHF Express at the time, which used the average retail transaction to calculate meal equivalents. And I found dealing with two different counting systems, to be very cumbersome. But I had been through one contract threat, and I was determined to continue benchmarking. Around 2000, Mecon was replaced by Solucent. HFM, a legacy association of AHF, met with Solucent. I think it was either in New York or Washington, but we met with them and proposed that they switch from using the market basket to the average retail transaction to calculate meal equivalents, and they did. And they agreed that a uniform methodology for reporting would be easy and it would make sense. And I'll tell you, it sure helped save me a lot of time in my hospital. Dave, this is another tool that you've used also. So do you have comments on this?
Yes. I've been an ActionOI user previously as well, and the thing about this, unlike some of the other tools, is that this is something that is probably going to be driven by your finance or by your organization. So it's not something that you're just going to pick up and be able to do. So and it's critical when you're doing this, and then periodically thereafter to look at the normalization reports to make sure that your things haven't changed in your department as far as maybe you took over delivering trays where you once weren't delivering trays. Well, you need to make sure that if you did that those type of things change in the ActionOI reports, because now you're going to be comparing differently. The good thing is that it has a wealth of information that you can be able to go out and talk to other people who are also ActionOI users. I learned a great deal from looking at the reports and finding somebody who was doing better than I was doing, and going out and picking up the phone and being able to talk to them. Of course, that's something that you would coordinate through your finance or whoever is the liaison with ActionOI, and then reaching out. And that's something that was probably one of the most beneficial things I could do, because sometimes you find that they're doing something a little bit differently that might be a little bit more efficiently. Other times you find that it's just a difference in the reporting and how they're looking at things. As well as, this puts you into a percentile ranking as well. And then, you can customize the compare groups. Generally, my experience has been that, the organization determines what the compare groups will be. But again, it's something that is another tool out there. And I think the thing is that, like Mary was just mentioning about the average retail transaction, today the tools that we're looking, I think 4 of the 5 are using average retail transactions. So something that I think is a very valuable tool, and something that many of you probably could be already doing with your organization.
Thanks, Dave. I just have a comment to make. I use this tool also, and it is so interesting to compare your productivity with the peers, with peer groups, because it's got a large database, and they too can connect with peers. But I think one comment, I'd like to reinforce what Dave said. It is a tool driven by finance. It is decided upon use by finance and administration. It comes from finance. It's controlled by finance, and that's not bad. But I always thought it's interesting that it was very easy for me to get finance to tune into numbers that were produced by ActionOI, because it's their tool. And I could use that by getting them to focus in on some of the numbers I was collecting with a different tool, because we compared the two. So it's a powerful tool, and as Dave said, it gives organizations a unique opportunity to look at performance improvement globally from all over. And Dave, our last tool is Operations Advisor. So do you want to start that?
Sure. And now, Premier Operations Advisor is something that our organization has been using for probably about the last 4 years, and many organizations are using Operations Advisor. And the difference in this is that this is really strictly focused on labor productivity. So again, very similar to Action OI, this is an organizational-driven initiative, and it's going to require you to have the information collected and reporting the statistics that finance requires you to do. So all of those things that we talked about in the beginning, developing the systems, developing the process of collecting the data, you need to have that in place, because even if you're doing some of these other tools, it's going to require you to have some of those really, really good systems set in place. Now, the benefit of Premier Operations Advisor is really, this is something that you can get back results rather rapidly. For our organization, we're getting payroll reports every 2 weeks. I know they can set it up differently for different organizations, so you might get it monthly or differently for some organizations, but every 2 weeks I'm getting a slew of reports that show where my productivity is, and administration has set the targets that every department within our organization has to achieve. And when budget reductions or any type of productivity questions come into question, that's where they look at this information. They say, okay, Dave, you've fallen below your 90th percent of your desired productivity level. Why is this? So they can help identify problems rather quickly. So you never want to get called into those particular meetings, because they have those every 2 weeks, but it does happen. And and generally our administration is very supportive, and they're helping you to find out what they can help you with more as more supportive. I think the key performance indicators that you have with Premier Operations Advisor would be your actual versus your budgeted hours and FTEs, your worked hours per unit versus the target, and looking at the overtime usage. And there is a nice productivity control chart where you can see where you're facing, where you're at within that productivity target. Again, just like every system that we've talked about, counting meals, and every meal is critical. There is that Premier support on initial startup. If you are thinking about doing Premier, if you're thinking about doing some of these other ones that your organization is doing, it's always helpful to reach out to other organizations that have already gone through that initial startup, because you want to make sure that you're counting everything properly and setting it up properly. Otherwise, you might be in for a surprise afterwards. So, and there is options, just like some of the other ones, to reach out and contact other facilities that are doing a little bit better than you are. So again, just one of the 5 tools that we've talked about today. And I think successful operators will definitely be looking at a couple of these tools at least to perform. And I know, Mary, you'd like to close it out with some comments about successful operators.
I do, but again, Dave mentions counting meals, getting credit for all of the meals and meal equivalents. We just can't stress that enough. And what I have found is everybody collects data. Everybody collects, at least I collected too much data. But we miss opportunities when it comes to some of these foregone revenue classifications. And all of the tools are telling us how to calculate meal equivalents. They're telling us in terms of Action OI, finance will tell you what your target is for worked hours per meal. So all meals are so important to count, and I think we all know that, but we get busy. So when we talk today about successful operators and what successful operators do, you know, I think today's healthcare market is changing. It's getting so much more challenging for everyone in it, and administrators included. Being responsible for managing finances is our job, and measuring what we manage helps us make decisions. Numbers are powerful, and a single number, for instance, 8% decrease in net cost per patient day or 10% increase in retail revenue, speak volumes and get people's attention. Using numbers to showcase your department, sharing numbers with your boss and staff, and especially relying on data to plan and budget translate into successful operators. On a personal note, I'm so passionate about this subject because I learned from a personal experience about the power of numbers. And a few years ago, I was sent to the ER. It was crowded. You know what that's like. And I thought, boy, this is going to take some time. A lot of people in there. I looked better than a lot of people did. Triage system is pretty quick, and the nurse took my blood pressure, which was 205 over 110. And for the clinicians in the audience will know that maybe 120 over 70 or somewhere around there. 120 over 80 is better, but 205 over 10 is pretty high. And that number, that one number, moved me from that room to immediate care. I was lucky. I walked out 4 hours later with a diagnosis of vertigo. But there was a busy ER with lots of people waiting, and it was one number. They didn't ask me anything. And administrators are busy, and the system we all live in healthcare is kind of crazy today. People don't have time for long reports. Numbers can work better. So I guess when we talk about success, it brings us to the end of this, and we talk about what we discussed today. Just to review, we discussed steps to getting started. They did a nice job on that. Gave an overview of the tools, 5 tools. There are more in the industry. They're all good, the ones that we looked at today. We talked about a process of counting meals and meal equivalents. Spent some time on foregone revenue and finding the data. So, you know, I hope that will encourage you to choose the best tool for you and start tracking financials. Because as Dave says, something is better than nothing. And Bernard, I'll turn this over to you.
Thanks, Mary, and thank you so much, Mary and Dave. Great job to you both. At this time, we will do a Q&A session until the top of the hour or until the questions run out. So if you have a question for Mary and Dave, please type it in the questions box on your GoToWebinar control panel at this time. And the questions that we don't have time for, we will still answer them and send them back out as an email to the entire group. And we actually do have a couple of questions that came in during the webinar. Sarah asks, I have financial reports from accounting and my hospital benchmarks with a company quarterly. Why isn't that enough?
I can answer that, and I think that's oftentimes a very common thing. And I'm a believer that we don't want to have data overload. However, some of the tools that we talked about today are organizational-driven tools, such as the quarterly report that Sarah just mentioned, versus maybe another tool, and that is something that is done more on a more frequent basis, like a monthly basis. And when you have that information at hand, you got to remember that the reports that you're getting back quarterly from some of the other programs may be so far delayed. You might be getting reports that are 6 months old because of the reporting, whereas with these other tools, you're looking at information that is much more accessible and gives you an opportunity to make changes prior to that. And again, it also gives you an opportunity to make changes on information that is shared with you, the director, before it goes to finance, before it goes to your VP, and then gets vetted to you. So I think there's so much value in doing a couple of the tools. I'm not a big believer of doing all of them because, again, it could be data overload. But, having a couple tools at your disposal that give you timely information, I think is an excellent way to do it. And, getting started with this, reach out to the individual vendors or the support, and have them help you set this up and get this going. So this is a great question. It's a question that comes up repeatedly, but I think it's something that I feel very passionate about doing at least more than one quarterly report a year, or more than doing just the quarterly reports a year. Mary, did you have any comments on that? Anything to add?
I'll certainly reinforce looking at your numbers more often than quarterly. So I totally agree with what you said, Dave. We don't want anyone to overdo in number collecting. But quarterly reports are fine, but if you have information leading up to those, you can perhaps stop a problem before it gets too big. So, no, Dave, I think you hit it on the head.
Thanks, Mary and Dave. Pika asks, can you utilize two benchmarking tools, for example, AHF and Action OI, to measure your facility's performance?
Yeah.
Absolutely. I think the challenge will be which one does your organization abide by. You can look at if your finance department is set on Action OI, it may be tough to have them buy into AHF. But on the other hand, like we just got had the previous question, doing AHF prior to that can definitely be something that helps support that. And I just take 1 minute to explain a situation that happened within our organization. Is several years ago we had a merger develop between two organizations, and one of the things that was the first piece of the merger was getting one of the big consulting companies that's out there to review both hospitals and both food service departments. And they wanted the information, and I could confidently submit the information to them, generally knowing what the results were going to be because I had already had this, was regularly doing this, and was able to submit that information rather confidently and knew what the results would be. So definitely an opportunity for doing both.
I totally agree with that. That is, my organization always used a quarterly benchmark system, and I always used a monthly benchmark system. And as long as the meal equivalents are counted the same way, it's a perfect combination. The food service director, I just want to point out, the food service director isn't the one to decide to use Action OI. That's a finance decision. That's an administration decision. But they are compatible, no question. That's a good question, by the way.
Very good question. Thank you very much. Joe asks, I have cut FTEs until I can't cut anymore, and finance knows that. I still get asked to cut more. Any advice?
Oh, boy, I'd like to take that one, Dave. That's what's happening to all of the people out there. Finance is looking at FTEs. Administration is looking at FTEs. I just talked to a hospital who had cut, this is a system, and they had cut until they can't cut anymore. And they were right. I mean, we looked at their numbers, and there's no way they could cut anymore without drastically changing their service. So in that case, finance knew they had cut, and still they want to cut more. But I think sometimes when finance says you got to cut, the emphasis on FTEs, and it's not simple to cut an FTE. I don't mean that by anything, but cutting FTEs brings it to the department level problem. What I say to people is, you know, instead of looking at the expense for labor, and I know that's important, look at how much food cost, for instance, can be saved by eliminating some of the free services. Put together a cost-benefit list for your boss, including something like free coffee, free meals, floor stock, which might not be controlled. If you were turned down in the past, you might get someone to look at it now. For instance, if you give your boss or administration a list of the free services and what they cost, might look something like free coffee for staff, $20,000 a year, floor stock, 20% over peer group, and that's where you use your comparisons. And I know in my case, I wanted to change floor stock, and nobody in administration wanted to change it. And I kept, like Dave said, kept going back and saying, okay, but this is what it costs. And last year, the cost increased by 25%. Do you really think this is helping the patients, or is this a staff issue? And I got turned down until money got so tight that administration said, okay, they can't cut any more FTEs. We believe that. They showed us that. But do we really want to continue paying for free services for this? And I just say to people, this is a new day. Budgets are tough. Administration wants ideas that will cut costs. And maybe if they wouldn't listen to it 2 years ago, give it a try again and see if you can help define what is normal and what isn't normal. And again, reach out to your peer groups and your other people in your circle to find out what they're doing. And because everybody I talk to says I'm supposed to cut FTEs and I can't cut anymore. And you know, I think it's time now to look at something other than labor costs and see whether or not food costs can help your facility, and maybe you can eliminate some free services to arrive at that. So I wish you luck on that.
Thank you, Mary. Paula asks, what is considered good standards or benchmarks in productive hours per patient day and costs per patient day?
That's a super question. Do you want to take that, Dave, or do you want me to give a shot?
I think, I can, I think it depends. And I think, I would probably defer that to you, and maybe it'd be something that would be a good reply to everybody as to what would be the best way to do it, because, it just generally depends. And we can look at the ranges, but it depends on your operations. Mary, I think, do you have any thoughts on that?
Well, I agree. People will call me and say, I'm going to be going to facility X, and I want to know what is the recommended standard, industry standard, however you want to say it, cost per patient day. But it depends. There's so many factors that can be involved in that. And when I say to them, there isn't any industry standard. We can talk ranges maybe, but maybe the West Coast is going to be a very different range than the East Coast. I live in Maine. I'm sure some of my cost per patient day might not be the same as somebody in California or New York City or somewhere else. So there isn't any one standard, but that's where these tools can help you, because the tools we talked about today provide percentiles. And I'll take, for instance, Express. If you're a facility and you want to know what your net cost per patient day is, if you are benchmarking in Express, you can get that information by defining your bed size and your region and where you, other indicators, whether your room service or what, you can really focus in and get a peer group and then see where your range, where your cost per patient day is compared to those within your range. So that's about the best, but they're just, everybody wants that industry standard for cost per patient day or net cost per patient day, and it's really not out there. That's why Dave and I want you to consider using tools to help you, because they will provide percentile ranges. That's a good question, and it sure is a common question.
Thank you, Mary. And for the sake of time, we'll go ahead and take one more question. And there's so many good ones, and I really appreciate everyone sending in their questions. What we'll do, Mary and Dave, is we'll answer the rest of them offline, and I can send them out in the post-webinar email that goes out. The last question will be, do you have any tips for comparing different types of hospitals within the same system? I manage a small critical access hospital, and we are often compared with our larger system hospitals. It seems like apples and oranges.
Well, it is apples and oranges. A small critical access hospital that is evaluated on patient days would never look as productive as a hospital that had a lot of patient days. So from that standpoint, that's not realistic. And the flip side is a critical access hospital may have many, many meals. And so I can look at the numbers for a critical access hospital and see that maybe the net cost per patient day is very high, but the worked hours per meal is amazingly low. So it just depends on where you fall, but I think it would be very difficult to compare critical access to an acute center. I'm not sure how you would do that with any one tool.
Well, and I think also, you know, especially if you're comparing, it sounded like the question was talking about within a system, so being compared to one facility to the next, you know, it's just almost impossible. You're comparing, like Mary said, complete apples and oranges. So hopefully there's some kind of education that goes into that, or, you know, the other thing to do is, you know, reach out to other hospitals who are in the same situation and find out what they're doing. But yeah, I can't see how you could be productive as an acute care facility serving, you know, potentially thousands of meals a day.
Great, thank you so much. Great questions, everybody. I'm sorry we couldn't get to all of them. As I mentioned, we will reply via email and share some of the other questions with you. Folks, by tomorrow, you will be receiving a post-webinar email from me, and that email will contain today's presentation handout, your CEU certificate. You will receive one CEU from the certifying board for dietary managers and from the Commission on Dietetic Registration, a link to the webinar recording for parts 1 and 2, also the registration link for Part 3. And Part 3, once again, is on Wednesday, November 4th. So if you haven't done so already, please sign up, and we hope you can join us for the final installment of our series. If you have any immediate needs, require support, or have any questions whatsoever, please do not hesitate to contact us for a free consultation. Mary or one of our excellent success coaches will be happy to speak with you. Please take a peek at our website, destination10.com, to see all of the services that DM&A has to offer. We are here to help you make your department better. Also, if you reference this webinar by using code KNDS10, you will receive 10% off this DM&A service. Thank you, Mary and Dave, for this outstanding overview on the 5 industry tools, which are so essential and great methods for helping us track our data. On behalf of Mary, Dave, and myself, thank you all for attending our webinar. Have a wonderful rest of the day. Goodbye, everyone.